how do you recognise a sick baby? Often parents who go home from the NICU are often worried that what if their baby gets sick again, and how will they know? I run through a few things briefly in relation to how to recognise a sick baby. But the most important thing to tell you is you know your baby better than anybody else, and go with your natural gut instinct. There's obviously a virus or a bacteria, and babies can get either of them. For bacterial infections, your baby might need an antibiotic. However, for a virus, your baby will not need an antibiotic. If your baby is started on an antibiotic after being with a GP, please make sure to start them on a probiotic. Antibiotics get rid of your good and bad bacteria, so a probiotic will build up your good bacteria. The signs of a virus and bacterial infection can be quite similar, so it's important to make sure that you get your baby checked if you're ever concerned. Your baby could be pale in colour, or could be breathing quite quickly, so faster than they are normally breathing. Or they could have increased work of breathing. As I mentioned earlier, increased work of breathing would be your baby's effort of breathing. So you might see that their shoulders are moving up and down, like so as they're breathing. Their chest is moving in and out quite dramatically as they're breathing. They might have some nasal flaring or some head bobbing of their head. Again, I'm going to attach a video of signs of increased work of breathing so that you can have a look at that too. They might have a high or low temperature, and it is important to know that babies can have a high or low temperature when they're unwell. The normal temperature for a baby is 36.5 to 37.5. As I mentioned earlier, the axilla thermometer is one of the things on your shopping list. An axilla thermometer is a thermometer you put in underneath your baby's arm to monitor their temperature. It is the most recognised and recommended thermometer to use in the newborn phase. As your baby gets bigger, you can go to the one for the ear. However, for right now, it's axilla, and then you move to the ear thermometer when they're bigger. They might be very sleepy, so not waking up for their feed, or not interested in feeding, or falling asleep during their feeds. Opposite to that is they could be very irritable and very unsettled. You might find it very difficult to get them to settle. They might be having large vomits. So it's quite common that babies have small possets after feed, like a mouthful of milk, that's okay. However, if they're having large vomits, or if they're having green vomits, then you need to make sure that you follow it up and get them checked. Finally, they might have a rash. It might be red or a purple kind of rash throughout their body. The most important thing to know about a rash is that as you rub your finger over it, it should disappear. So go white, and then as you lift your finger, it should reappear as red or purple, okay? The same principle will be with a glass. You'll see some people rub a glass over the rash to see if it disappears. Your rash should always disappear. If it doesn't disappear, it is a rash that you'd always get followed up immediately. So during the day, you bring your baby to your GP, and at night time you go to the A&E department if your baby has been unwell and now has a rash that will not disappear. In this case, they'll look and examine your baby and make sure that your baby isn't suffering from meningitis. I'm not telling you that to scare you, but I'm telling you that to make you aware that actually it's okay if your baby has a rash as long as it's disappearing. If it's not disappearing, it needs to be followed up immediately. Often viruses leave the body and end in a rash. So you might have a baby that's been a little bit off their feeds, or maybe sleeping a bit more than normal, and then develops a rash, okay? And that's often the sign that a baby has a virus and that it's beginning to leave their body, and they should be back to themselves in the next day or two. Again, I need to reiterate that if you're ever concerned about your baby, if you're ever shown signs that they're unwell, always follow up with your GP and get them checked out.